So now we're going to do a breakdown of a room. Put on some clean gloves. And before I start touching anything, I'm going to get my wipes out, which has too much liquid in here. So basically whatever you touch you need to wipe down, but I'm going to start off with the tray. And what I normally do is I go through and get everything that can be thrown in the trash and go ahead and throw it in the trash. Put the tops back on. Put that to the side. So anything that's basically not biohazard, you can throw in the trash. So I go ahead and just take the floss off of the dental clamps, because the less that you have on the tray, the easier it is for them to, or yourself, to break down into sterilization. So I go ahead and I put everything that needs to go. On my tray. I'm going to cover it up. And I'm going to go ahead and take it to the sterilization room. And when you're walking, you need to make sure that you're not holding it like this, because if you trip and fall, you can land on it and have scattered. So when you walk, you kind of want to walk with it to the side of you, so it doesn't, if you fall, you're not stabbed with instruments. I'll start off with wiping down the curing light, and then make sure I get the handles and everything. Some places they actually put a barrier over it. So I always like to wipe it down good. Even if it has a barrier, I recommend to wipe it down. Then I get the cord and I tuck it back, just because when the cord is hanging down, you can trip over it or cause the curing light to fall off and break. So I'm just going to wipe down the material that we use. And I like to go ahead and put it back where it goes once you get done wiping. And everything has a certain spot it goes to. So whatever your room, how they have it set up, it's always nice to have it set back exactly the way that the doctor prefers. So I also wipe down the pens that are used if you do not have a plastic barrier over it. I'm going to wipe these glasses down and put them back where they go. here we use headphones, and I always wipe the headphones down. Wipe the nose piece. And when putting up the nose piece, you want to make sure that there's no kinks in the tubing. And you hang it back up. So now I am going to wipe this area because we did touch it with our gloves. And this has a plastic barrier over here where we call or page someone to come, so I wipe that off. And the keyboard has a plastic barrier, so we still wipe that off. Hit the cabinets quick. Okay, so now I'm going to start make sure you're cleaning there. Good. And it's always good to go ahead and untangle your hoses while you're cleaning them, just to make it look neater and be a little bit more easier for the next person who has to come in here, so they don't have to stop what they're doing to untangle the hoses. I'll make sure I'm going to wipe that really good. Clean this hose real good. Right, sorry. Have that all nice and neat. So now I'm going to wipe down the chair. I make sure that I get even on the sides. That's one of the most missed spots. And also get at the feet too. You need to clean the whole chair. Clean the entire chair. Really good. And also, you make sure if you have the barriers, take the barriers off and wipe. Always clean the entire white, because everything sprays and everything just gets everywhere, and plus it kind of cleans off the dust if there's any. Wipe the chairs down. And the most missed spot is right here when you adjust the chairs. You're always adjusting when you are assisting or working on a patient. You need to make sure, and you touch it with your dirty gloves, you need to make sure that you clean that also. And also over here on the operator's chair. Which this one has one that goes all the way around, so I just wipe it down. And then always wipe down the counter one more time just to make sure I have everything, and do the sink if it, and just do everywhere. And that is